good candidate for a penile implant is a man who's interested in the procedure, and the main medical thing is being able to have a surgery. So men can have other comorbidities or other medical diseases, but they have to be able to have a surgery. Another thing that can be a factor is being able to have the hand dexterity to operate a penile implant. However, for men who don't have that hand dexterity, there are other options like semi-rigid penile prosthesis that can help with that. Many insurance companies will cover a penile implant procedure. For example, Medicare does cover penile implant surgery. However, there are some employer-based insurance companies that do not cover anything for erectile dysfunction, including penile implant surgery. When we're talking about penile implants in the United States, there's two main subdivisions of penile implants that we frequently use. One's an inflatable penile prosthesis, and the other is the semi-rigid penile prosthesis. So an inflatable penile prosthesis is one where when you're not using it, it's flaccid, there's no erection, and then whenever you are ready to use it, it pumps up. A semi-rigid is always able to have an erection. It's just something that can be moved to a different kind of orientation whenever you're ready to use it. An inflatable penile prosthesis is the thing that we use in most men. So when you're not using it, the penis is flaccid, you can't tell it's there, but there's a pump in the scrotum, which whenever you're ready to use it, you pump it up, and then you're able to have a good rigid erection. Typically, not in all cases, there's a reservoir, which has filled with saline fluid to run the whole system. And this is opposed to a malleable or semi-rigid penile implant where there's always an erection, but it's bendable so that when you are able to, or are ready to have intercourse, then it can be moved into a position to make that easier. We size a penile implant at the time of surgery based on each man's anatomy. So we measure the portion of the penis that's outside of the body as well as the portion of the penis that's inside of the body and make sure that we get the full length so we're not shorting you, but there are anatomical limitations as to the size of penile prosthesis that we put in. To operate a penile prosthesis, there's a pump in the scrotum, which is what's used to pump it up and deflate it. So to use the device, you just squeeze on the pump, and it will take a certain number of pumps. Each man is different, each device is different for how many pumps it takes, but pump it several times until it is rigid. And then you can use it like normal. Whenever you're done, there's a button on the top of the pump that you can press, and either, depending on the exact device, either keep holding that button and squeeze the penis to deflate the device, or in certain ones, pressing the button and then you can use both hands to deflate the device by squeezing the penis. It is important to deflate by squeezing from the end of the penis to the towards the body to deflate it appropriately. For most men, ejaculation and sensation will be the same after a penile prosthesis surgery. It is important to remember that some of those things that are related to erectile dysfunction, for example, prostate cancer surgery, can change things like ejaculation. So after prostate cancer surgery, men won't have normal ejaculation. The implant is very easily concealable. It's all contained inside the body, so no one's going to know that you have an implant when you're walking around. Even if you're walking around in the locker room, it's hard to tell that there's an implant there because it's flaccid when it's not being used, and then the pump's fully contained inside the scrotum, so it is very easily concealable. The penile implant is made of a synthetic material that is designed specifically for penile prostheses. So it's meant to be rigid enough for intercourse, but flexible enough to be concealable when not in use. The solution that's inside the implant is typically saline, and that's what we use here at the University of Utah. It's an inert material, so even if there were to be a leak or something like that, it would just be absorbed by the body. During a penile prosthesis surgery, we make an incision either above the penis in the groin area or in the scrotum, depending on the surgeon. I will typically do them by making a small incision above the penis. And then what we do is find what's called the corpora, the area where the blood fills in the penis. Open that up and then size how big the penis is both inside the body and outside the body. Pick an appropriately sized penile prosthesis device. And then we place it there in the penis. We sew it up so that it stays in place. We put the pump into the scrotum, and then we implant a reservoir, which houses all the saline to run the device, either by the bladder or under the muscle of the abdominal wall. Most men can get back to their normal daily activities pretty quickly after surgery. So even the day of surgery, you can walk around, go up the stairs, those kinds of things. However, things like going to the gym, sports, those take longer to recover from surgery. It usually takes about 2 to 3 weeks before men are comfortable enough getting back into those kinds of things, going to the gym, running, etc. I urge men to listen to their bodies, and if something's sore, don't do it, and really just easing into more aggressive activities. It is also important that you refrain from sexual intercourse for 4 to 6 weeks after surgery. Most men will be able to use their penile prosthesis about 4 to 6 weeks after the surgery. Of course, there are special circumstances, so if your surgeon has told you otherwise, please do follow those instructions. The amount of time a penile implant will last after it is placed depends on the device. So depending, it can last 8 to 10 years or up to 15 years. Now, if you're not using the device, it doesn't mean that it has to be removed at any particular time, but typically the lifetime of the device is between that 8 to 15 years. Satisfaction rates are high after penile implant surgery for both patients and their partners. Depending on what we asked exactly, it's between 92 to 97%. There are risks with any medical treatment or any surgery, so the same is true for penile prostheses as well. The main risk that we worry about is infection of the penile prosthesis. We do everything that we can to make sure there is no infection, but it still can happen. In the literature, it's up to about 5 to 7% of the time. We do a lot of things to make sure it's as low as possible and lower than that. Other potential risks are bleeding, especially if a man is on blood thinners, damage to surrounding structures. So there is the bowel there, the bladder, that we are very careful, and things like that are very, very rare. Other potential risks are risks of anesthesia, which are very uncommon in healthier men, but can be higher risk in men with other medical conditions. And there are risks of mechanical malfunction of the device, so it doesn't work, there's a leak, things like that. And then some men complain of loss of penile length, which is associated with erectile dysfunction and things like that. We try to do everything we can to do as large of a size as possible, but that is something that some men are unsatisfied about.